Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, May 26th. We are joined today by Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Kevin Klein and French language translation services by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email ecoinfo@yukon.ca. Premier Silver?
Thank you very much, Pat, and good morning to everybody. It's great to be here with Dr. Hanley on the traditional territory of the Kwanlundun First Nation and the Ta'an-Quachin Council. Yesterday marked a turning point for our territory as we look to emerge from the pandemic and get onto the path of recovery. The territory's vaccine uptake to date has been very great to see. As of yesterday, 77% of eligible Yukoners have received their first dose and 69% have received their second dose. Because of our successful rollout, we have been able to safely start lifting restrictions as part of our Path Forward plan. Fully vaccinated people no longer need to self-isolate upon entry into the territory. These individuals need to sign a declaration that they've been fully vaccinated and need to provide consent for the verification of their vaccine status in order to be exempt from self-isolation requirements. We can currently verify the status of those in Yukon and in BC, and we are working with health officials across the nation for the rest. If an individual provides consent for the verification of their vaccine status, personal health information will only be accessed by the Health and Social Services staff who are authorized under the Health Information Protection and Management Act, or HIPMA for short. If an individual does not want to consent to providing that information, they can still enter the territory as long as they self-isolate for the 14 days. Other changes that came into effect yesterday include bars and restaurants returning to full capacity for table service. Social bubbles can increase to 20 individuals. Social gathering sizes can increase with physical distancing. Indoor gatherings up to 20 individuals with mask use. Outdoor gatherings up to 100 individuals. Organized indoor and outdoor gatherings and events can increase to 200 individuals with physical distancing provided the venue or space can accommodate. Funerals, weddings, and faith-based services can increase to 200 individuals with physical distancing providing that the venue can accommodate in that space. Gyms and recreational centers can increase to 200 individuals with physical distancing provided the venue or space can accommodate. And camps and recreational programs can increase to 20 individuals indoor with physical distancing and mask use, and 100 individuals outdoors with physical distancing. These changes are based upon the recommendations from Dr. Hanley and are guided by our Path Forward plan. We continue to take a careful and measured approach to these restrictions. Our top priority, as always, is protecting the health and safety of Yukoners, and that is why we will be extending the state of emergency, which is set to expire at the end of this month. Now, by extending the state of emergency, our government remains flexible and able to adapt to potential rapid changes in the COVID-19 situation, including monitoring the third wave in Canada and reviewing emerging data on variant spread to inform our decisions. Ministerial orders issued under the Civil Emergency Measure Act are what allows us to set requirements for entry to the Yukon and mandatory self-isolation. These measures have helped keep Yukon safe over the past year plus, and we need to keep them in place for now. COVID-19 remains a major threat in our country, but we are hopeful that as vaccines roll out in provinces, that case numbers will steadily decline in the coming weeks and months. We are encouraged to see the progress in British Columbia when it comes to COVID-19. Yesterday, they announced their plans to lift restrictions if things continue to go well. We are well ahead of British Columbia. If things go well, they are looking at lifting travel restrictions in mid-June and modestly increasing gathering sizes. They are still in the process of building their foundation to restart. We have already established that foundation, and thanks to the strong immunization rates here in the Yukon. When our youth clinics open next week, I hope to see those numbers continue to climb. Again, we are in a fortunate position thanks to the diligence of Yukoners and the amazing public servants that have delivered critical services and programs, including immunizations, over the course of the pandemic. We need to keep it up. Canada's Chief Public Health Officer, Dr. Theresa Tam, recently called the Yukon a model that we are all looking towards for success. This is high praise, but we also take that responsibility extremely seriously. While we have lifted restrictions, we still need to keep our guard up against the virus. Our thoughts are with our friends in Manitoba as they deal with their most intense wave yet. Yukoners are still required to follow the Safe 6+1, masking up. You can also still receive your vaccination if you haven't already. I encourage all Yukoners that have not received a shot yet to step up and get one. The simple fact is that the more people that get vaccinated, the safer our territory will be. To book a vaccine appointment and to find out more information, please visit yukon.ca/thisisOurShot. Before I hand things over to Dr. Hanley, I just want to note that it is Tourism Week in Canada. I know that with spring in the air, we are all thinking about traveling again, and lifting self-isolation requirements for fully vaccinated people is welcome news for our tourism operators. Tourism Week recognizes the impact Canada's tourism industry has on every community from coast to coast to coast. Throughout the pandemic, Yukon's tourism businesses have put the health and safety of Yukoners above their own interests and at great costs and sacrifice to themselves. This week is a great time to recognize and to thank the tourism industry here in Yukon. Yukon's tourism sector enriches the Yukon in so many ways, beyond just our GDP. To call the Yukon home is a truly exceptional privilege, and for our friends and neighbors in the tourism industry, this feeling has also become their calling. I encourage Yukoners to make this your summer to explore Yukon. Tomorrow we will be unveiling more information about the Great Yukon Summer Campaign. You may be surprised by the amazing tourism experiences that are offered here in our own backyards. Whether it's the trip that you've been putting off for years, the someday trip, or revisiting these local attractions that are just down the road, this is definitely the moment to do so. This Tourism Week and all summer long, let's celebrate the people, the experiences, the events that make our corner of the world such an incredible and beautiful place. As you return to your favorite spots in the territory or discover new ones, just remember to travel safely and respectfully, no matter where you go. Thank you very much for your time today. I'll pass it off to Dr. Hanley.
Thank you, Premier. And you certainly have me all excited about summer plans now. Again, this week there are no new cases of COVID-19 in Yukon to report. And the reduction in new cases compared to a few weeks ago is likely a reflection of reduced importation risk for new cases as COVID activity in most regions of Canada, including BC and Alberta, declines. This is certainly encouraging news. This is also not the end of the pandemic, not yet. We will see new cases from time to time, and we still could see clusters or outbreaks associated with case importations if we relax our public health measures too quickly or too soon. At the same time, the expected impact of any single case or even cluster of cases is undoubtedly much less from what we would have seen even a few short months ago. When we had first started to see cases diagnosed in Yukon, COVID-19 had many unknowns. Our goal was to minimize cases in the territory in order to minimize the possibility of spread and the potential to affect people in large numbers, cause severe illness and deaths, and strain our healthcare system. Now we are in a different place. With high and still climbing vaccination rates, as long as we don't see a major shift in viral strains or other twists in this pandemic, we should be protected from those more severe impacts. I feel and I welcome a new sense of calm in the community. There is not the fear that was palpable before when we announced new cases. I think there will be growing acceptance that it is much more useful to communicate our estimates of risk rather than simple case updates. I would like to think that we will, at some point, get to a stage where we won't need to announce every case of COVID, just as we don't report on every case of influenza. As we move into this major reopening week, we are solidly on the path to recovery. As we head in this direction, we should see that COVID eventually becomes one more disease that we have to live with and adapt to. What that will look like could still take on a number of different forms. Will we see outbreaks of new variants? Occasional cases and clusters amongst the unimmunized? Cases where vaccine immunity starts to wane? Until the global situation is well under control, much of this unpredictability of COVID-19 will remain. That is why we will need to keep our eyes on this disease for years to come. We will need to keep testing for COVID when symptoms occur. We will want to maintain strong surveillance to detect new cases, outbreaks, or variants. Although our transition to post-pandemic life should continue to progress over the weeks to come, COVID-19 will remain with us, and we will live with it. As long as the world is grappling with community spread and large outbreaks, this will continue to be a pandemic, even though we may ourselves in Yukon feel insulated. Eventually, the world too will get over this, and COVID-19 will move from pandemic to endemic disease. It may continue to pop up from time to time or circulate regularly, but with high vaccination rates and a much lower number of susceptible people, we will manage just as we manage flu and other viruses. Variants will continue to rise, particularly as high COVID activity hits many parts of the world. Vaccines may need to be adapted to variants, and we may need regular vaccine updates. So far, as we learn more about the variants of concern and how vaccines work against them, we can be cautiously more confident in our ability to manage COVID-19, even in the face of these new varieties. Speaking of variants, all of our recent cases have been variants: B.1.1.7, P1, and most recently we confirmed B.16.17, or the so-called India variant, in our most recent case. Our case management approach for the last few months has always assumed the presence of variants. Just as we have done from the beginning, these cases were very capably managed, first by the individuals and their families, and second, by our skilled and seasoned communicable disease team. One of our longer-term management tools will be testing for COVID infection. Testing, of course, has always been a key part of our strategy to identify and contact trace for COVID. Testing will be a tool to protect us well into the future. Testing will, with more time, be more accessible as rapid testing becomes more available. Testing for COVID continues to be vital. Even if you are vaccinated, if you are experiencing any symptoms of COVID-19, please do get tested. Over the months ahead of us, COVID-19 will slowly cease to dominate our lives. As we continue to get vaccinated, seek testing, and practice the safe 6+1, we can feel confident that Yukon will remain in a stable position. A phased and carefully managed reopening will help us maintain our confidence and stability and eventually put this pandemic to rest. Yesterday's package of reopening measures included relaxed self-isolation requirements for the fully vaccinated, adjustments to gatherings, including weddings, faith-based gatherings and funerals, and changes to social bubbles and increasing capacity at bars and restaurants. Easing our self-isolation restrictions has perhaps been the most dramatic change, where those fully vaccinated are exempt from self-isolation. If you have received a dose of a Health Canada-approved vaccine at least 14 full days before you enter Yukon, you are considered fully vaccinated. I hope that the news of these revised guidelines will allow people to resume planning what might have been previously postponed. Weddings, traditional ceremonies, visits to see family members, and attend social gatherings with old friends. At the same time, we need to move with Canada and our 12 sister jurisdictions, being mindful of what travel guidance or orders are in place in any particular region. Ultimately, I hope Yukoners are able to return to things that have been on hold for many months. Without Yukoners' care and vigilance, we may not have been able to announce such changes at this time. We are in a curious position where the COVID situation is so varied across the country. Although we talk about progressive reopening, and many places, most recently BC, publish their plans for the near future, the stark reality is that many places are still imposing restrictions or lockdowns to bring COVID under control and to save lives. Sadly, it is now Manitoba's turn to fight the peak of COVID activity, with ICUs so full that some patients have to be diverted out of province for care. Once again, we can only be grateful for how well we have done and how much loss and tragedy we have managed to avoid. As the Premier says, we continue to see progress in vaccine uptake, and now at 77% uptake of first dose, 69% second dose amongst the 18-plus population. And we see with each age group that creeping up of numbers. So now in the 18 to 29 age group, first dose uptake is now 68%. All the other categories are now well above 70%. 30 to 39 age group, 74%. 40 to 49, 76%. 50 to 59, 78%. 60 to 69, 84%, and 70 plus, 91%, with the second dose uptake only a few percentage points behind in each case. Now we are in that phase of slower uptake, but each week continues to see us increase our overall first and second dose percentage uptake. This steady increase gives us more and more security in our ability to lift additional restrictions and get us steadily back to normal ways of interacting. Already next week, we begin our quest in vaccinating 12 to 17-year-olds with Pfizer. Once more, many people have put long hours into working out this special program to protect our youth. This will be a blitz campaign with an experienced and small vaccination team traveling into Yukon communities. There will be one clinic for first dose and a return visit about 3 weeks later for the second dose. While appointments can be made for community immunizations, walk-ins will also be accommodated in rural Yukon. These clinics are only for youth, and other members of the community should get their vaccine at other opportunities, allowing the small teams to concentrate on the 12 to 17-year-olds at this time. For those parents who are questioning whether Pfizer is the best option for their child, and also for those who are asking for Pfizer for themselves instead of Moderna, I want to assure you these two messenger RNA vaccines are basically two variations on one theme. Even though there are slight differences in the components, they are both vaccines that package messenger RNA inside a lipid or fatty envelope that delivers the RNA to its destination inside the body's cells. From there, blueprint instructions for manufacture of the COVID-19 receptor proteins are passed on, and the body's cellular machinery gets to work. The minor differences in vaccine components lead to the different storage and dosage requirements for each of the two vaccines. But in the way the vaccines work, they are so similar they can be considered completely equivalent. The clinical trial results, as well as the real-world studies of these vaccines in use, show remarkable similarity in effectiveness, both of them in the 90 to 95% effectiveness range in study after study, with similar results against currently known variants. In fact, when circumstances dictate, one mRNA vaccine can even be substituted for the other. Some people have been requesting Pfizer vaccine either because of individual preference or because they have received a first dose of Pfizer elsewhere. I want to clarify that at this time, the Pfizer vaccine is solely for the 12 to 17 age group. For the time being, we are not in a position to administer Pfizer to individuals who fall outside of this age group because we do have a limited supply that needs to be specifically allocated to the intended demographic. We have, in fact, offered Moderna vaccine to several people who have moved to Yukon after having received a Pfizer vaccine dose elsewhere, and I am completely confident that their immunity to COVID-19 is just as good as with 2 doses of either vaccine. Now, I mentioned a slowing down of the vaccine uptake curve. That is also where we address the age-old question of vaccine hesitancy. Reluctance to be the first in line for vaccine is normal and expected. There is always a rapid uptake and then a slowing down, which has nothing to do with the effectiveness of the vaccine rollout or the community trips. That's why I'm so gratified to see the continued rise in vaccine uptake from week to week, even though the relative rise is small. It means that we are able to address the questions and concerns that people have through engaging with leaders and influencers, through working with and supporting our doctors and nurses to answer questions, and with incentivizing people with the ability to forego travel self-isolation when fully vaccinated. Vaccine hesitancy is considered as part of any vaccination campaign and is planned for accordingly. Although we have vaccinated a greater portion of the population, we will consistently work alongside our partners, communities, and individuals themselves to listen, learn, and answer any questions that Yukoners may have about vaccination. Vaccination is an exciting way out of the pandemic. Reaching everyone is a long process, requires many conversations and tremendous collaboration amongst our partners. I want to ensure that all our various communities, whether physical communities, faith or ethnic or cultural, are heard and their questions are answered. We will steadily continue to work through vaccine hesitancy for the months to come, as each person should have the opportunity to have their concerns heard and their questions addressed. So that's it for today. I hope we all have a good rest of this short week, and please continue to take care of each other and remember to be grateful for what we have and stay well. Merci. Thank you.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll move now to the phone lines and begin with Luke from CKRW.
Hi, I have a question for Premier Silver. I'm curious what the process is if somebody who is fully vaccinated that's coming from a jurisdiction other than BC or just somebody returning to the Yukon, what the process of verification is right now, because there is no specific protocol in place for that.
Yeah, thanks for the question, Luke. It's a great question. Again, when it comes to the ones that we can verify right now, it's Yukoners and BC. We have a very similar, we have huge connections with British Columbia as far as sharing of data. So right now we can verify information from Yukon and from British Columbia, and we're continuing to work with those other jurisdictions across the country to sort out the verification for those other Canadian jurisdictions. Dr. Hanley and I have been talking about this. It's a live conversation for sure, and I think the details of this can be worked worked out very shortly. We're in a position right now where we have the recommendation from the Chief Medical Officer for vaccinated individuals, making sure that there's that 14-day in between, and we're just working out the final details of those systems that we aren't so closely attached to, like British Columbia. But the details of that will be coming out very soon. But we've been saying for weeks now that we can verify these two. We've also been saying very clearly that if you don't want to share that information, you're not compelled to do so. An individual still from anywhere in Canada, you can still come. You just have to do the self-isolation if you're not going to share that data. And for those regions where we still have a couple of nuances to figure out, we'll provide the information on that as soon as we possibly can.
Thank you. Do you have a second question, Luke?
No, just the one for me. Thank you.
Thank you. We'll move to Philippe, CBC Yukon.
Yes, thank you. This is the question for Dr. Hanley. On the topic of Pfizer and Moderna, you mentioned one can be substituted for another. We got a call from someone in Dawson City. She was in BC for medical treatment and there received the Pfizer vaccine. Now she's back in Dawson and is trying to get her second shot and would have access to Moderna. Do you mind giving advice to this person? Is it possible to get one and then the other?
So, Philippe, thanks for the question, and it does relate to what I was talking about. And I'm not going to give a specific recommendation for that individual because we always do case manage individual considerations. But I think the key message is that we have Pfizer only for a very limited time for a very limited group. And so this is not Pfizer that is in territory and available for second dosage for people having previously received Pfizer. So we recognize that the NACI recommendation, the National Advisory Committee on Immunizations, is that preferentially where both vaccines are available, it makes sense to continue with the same product. That would apply to really any vaccine where clearly if you can continue with that same product, then it kind of makes sense. But we have ample supplies of Moderna, and we do know that where circumstances dictate, so where availability is limited of the second one, that is perfectly okay to substitute one for the other, that you can continue a Pfizer with a Moderna or vice versa, and you can expect the same equivalent immune response. So really the message that I'm trying to say is that when we do receive individual requests and we provide advice, but the general message is to reassure people that these two vaccines are equivalent vaccines.
Thank you. Do you have a follow-up, Philippe?
Yes, I wonder what are the conditions for rules on masks to be changed, and could we expect to see change in the future?
Yeah, thanks, Philip. That is also an important question, and it's of course one that we're deliberating on as we speak. Clearly, there will be eventually a phasing out of mandatory mask usage. I would say we have some phases to get through first. So we have, of course, a lot of changes happening as of this week. And as always, as the Premier mentioned, we want to have this kind of cautious approach. We want to see the success, and then we want to be in a position to recommend next steps. So we do see that there will be recommendations around mask use in future phases of reopening based on continued success with our current reopening and with stability of the pandemic, of course. Now, I do think that masks are going to play an ongoing role in the future more than they ever did pre-COVID. And it may be that in a way we will be finding ourselves catching up, as it were, to what has been common practice in Asia, and is to use masks perhaps more liberally in circumstances where there may be circulating respiratory viruses. So I think more to come. We have said before that physical distancing and mask usage are likely going to be some of those later removals in our phased reopenings. We want people to feel confident and to have those sort of individual level protections in place as we go through these very significant changes to the ability for people to gather and socialize.
Thank you. We'll move now to Tim, Whitehorse Star.
Yes, thank you. Good morning. My first question is for either the Premier or Dr. Hanley. Is the system up and running properly for BC and Yukon residents to check their vaccine verifications? Is everything running properly?
Thanks, Tim. Yes, as far as I know, everything has been up and running, and the verification team is working away on requests. So I have not heard to the contrary.
Do you have a follow-up, Tim?
Yes, I do. Although it just fled from my mind for a second. The Canadian Ombudsman, once again this week, have just released a news release about the vaccine passports, warning again it's a very tricky proposition. Have either of you had a chance to look at what they're recommending?
So again, we're definitely going down the road very cautiously to make sure that we're, allowing for a loosening of guidelines, trying to get back to a more sense of normal, and doing that in the least intrusive way possible. And every step that we do, we have quite the process here with recommendations from the medical community, and going through a myriad of departments to make sure that we're doing things properly, and we'll continue to do that at every step. We're very encouraged by our vaccine numbers. We're very encouraged by where we are as a region, and we're going to continue down this path of putting safety of Yukoners paramount. I haven't seen the latest from the Canadian Ombudsman, but I will definitely be looking at it.
Thank you. We'll move now to Claudiane, Radio-Canada.
Peut-être juste en français, Dr. Hanley, me réindiquer la situation de la vaccination en ce moment au territoire. Où est-ce qu'on en est? Est-ce qu'on prévoit d'autres assouplissements à venir sous peu?
So, Dr. Hanley, can you please repeat in French where we are at this point with the vaccination campaign, and if you are looking at having some of the measures removed shortly?
Oui, merci Claudiane. Oui, on continue de faire des progrès avec la réception de vaccins et le taux dans chaque catégorie selon l'âge, c'est que pour la première dose, maintenant on a atteint 68% chez les jeunes, les 18 jusqu'aux 29. Et puis 74% pour les 30-39, 76 pour le 40 jusqu'au 49, 78 pour le 50 à 59 et 84% pour le 60 jusqu'au 69. Et pour ceux qui ont plus de 70 ans, on a atteint maintenant 91%. Pour un tiers de la population éligible, moyen de 77%, avec deuxième dose maintenant 69%. Donc, on est dans une situation, j'ai expliqué en anglais, on est dans une situation avec une croissance semaine après semaine, même que c'est une croissance assez moins aiguë qu'avant, on voit toujours une accumulation de doses semaine après semaine. Donc, c'est ce qu'on a attendu. On a attendu un accès rapide, une accumulation rapide dans les premières quelques semaines. Et maintenant, on a les gens qui étaient peut-être plus hésitants, qui avaient plus de questions, qui avaient besoin plus de temps pour considérer. Graduellement, ces gens-là viennent pour recevoir aussi le vaccin. Donc, je suis très content d'avoir cet progrès semaine après semaine. Donc, ça continue de nous donner confiance et la force pour continuer avec les réouvertures. Donc, on a les grandes étapes à partir de cette semaine. Et on voit dans le futur plus d'ouverture selon le succès qu'on peut témoigner avec les étapes qu'on a présentées cette semaine. Et avec, j'espère, avec l'amélioration continuelle de la situation au Canada et de voir le graduel de monter la taux de vaccination pour le reste du Canada aussi.
Merci. Avez-vous une autre question, Claudiane?
Oui, donc on avait parlé au tout début de la pandémie l'an dernier du 75% pour atteindre l'immunité collective. Est-ce qu'on a atteint ça et qu'est-ce que ça permet maintenant? Est-ce qu'on peut dire que la vaccination fonctionne?
So at the beginning of last year we talked about getting 75% vaccination to get to collective immunity. Would you say that right now we have achieved that? And what does it mean for the future in terms of reopening in the Yukon?
Oui, c'est une bonne question, mais on a aussi la question de qu'est-ce que c'est l'immunité collective et qu'est-ce que c'est le but ou le nombre magique. Et c'est devenu plus compliqué à estimer à cause de les variants. Et donc, si c'est assez où on est maintenant, ou si on a besoin 90%, ou entre les deux, ce n'est pas sûr. Donc, c'est sûr qu'on est dans une bonne étape maintenant pour être stable, même en face des cas. La probabilité d'avoir une éclosion, une grande éclosion, est très peu à ce moment. Mais on va voir avec l'expérience. Et donc, c'est pour ça on est confiante. Si on a 10% en plus, on peut avoir 10% plus de confiance. Donc, c'est le mieux, on peut dire. Et le plus qu'on voit, on peut voir, le plus confiante la plus confiance on peut avoir pour voir plus de réouverture. Mais c'est aussi, ça serait basé sur le succès de ce qu'on a sur place maintenant. Donc, 3 semaines d'ici, on va voir si tout est stable, si on continue d'être dans un bon état, si l'état de vaccination continue d'accumuler, on peut prendre les prochaines étapes et graduellement aller plus proche à le normal qu'on a connu avant.
Thank you. On va maintenant passer à Laurie, l'aurore boréale.
Oui, ma question est sur la vérification des vaccins. Vous dites que vous êtes en train de peaufiner tout ça. Si quelqu'un vient d'une autre province que la Colombie-Britannique aujourd'hui, qu'est-ce qui se passe? Comment ça fonctionne? Est-ce que la personne va devoir faire une quarantaine vu qu'on n'est pas en mesure de vérifier? Comment ça se passe?
So, if somebody is coming to the Yukon from elsewhere than British Columbia, so what are exactly the steps? What is going to happen with this person? Do they have to self-isolate? And what are the next steps after that?
Oui, je peux expliquer ça que la situation jusqu'au maintenant, c'est que les gens, avant que la vérification prenne place, la personne doit rester dans quarantaine. Donc, comme le premier a dit, on travaille beaucoup maintenant pour voir les détails, pour finir tous les détails qu'il faut pour avoir un procès de vérification. Mais jusqu'au ça s'est réalisé, la personne reste en quarantaine.
Avez-vous une autre question, Laurie?
Donc, juste pour être certaine, pour l'instant, les seules personnes pour qui ça fonctionne, les nouvelles lois qui sont rentrées en vigueur dans les dernières semaines sur l'entrée au territoire quand on a 2 vaccins, c'est seulement pour la Colombie-Britannique.
So just to make absolutely sure, so the new conditions that do apply for people with 2 vaccines are only for those coming from British Columbia.
C'est pour maintenant, oui, parce que la vérification peut être accomplie pour les gens qui viennent, pour les Yukonais ou pour les résidents de Colombie-Britannique. On a les moyens maintenant pour vérifier le statut et c'est aussi selon l'attestation de personnes suivies par la vérification. Donc, c'est tout en place. Pour les autres, comme la première dit, pour les autres endroits au Canada, c'est toujours en progrès pour finir toutes les détails. Et donc pour aujourd'hui, s'il y a une personne aujourd'hui qui vient dehors de Colombie-Britannique, qui n'est pas en Yukon, c'est la personne reste en quarantaine.
I'd like to thank everyone for their time today. The next COVID-19 update will take place on Wednesday, June 2nd at 10:30 a.m.